Hey, y'all. This is Farley with Writer's Edge Podcasts. And today I'm going to have a conversation with Nicole Coleman. Welcome, Nicole.
Thank you, Farley. Excited to be back. I love your podcast.
Oh, thank you so much. I'm so glad to have you back. We talked earlier in an earlier episode about the pelvic core and how the pelvic floor relates to your core muscles and different things. And we promised that we would come back and have other conversations about the pelvic floor. So to kind of preferences before we get started, we will talk a lot about the pelvic floor today and things that may seem taboo for people to talk about or may make them uncomfortable. But I know both you and I, Nicole, are very big proponents of educating people, even if it's uncomfortable, so that they can make their best healthcare decisions about them and their bodies, and to educate other important people in their life. So it may not be something that they are going through, but that they have a family member that's going through it, or a real close friend or something. So I'm a big fan of education. We can't learn too much.
Absolutely. And so many people that have come to me over the years have said, I don't even have the words to explain my symptoms. So those who are suffering in silence don't even know how to talk about it or who to go to talk about it, and how to describe the symptoms they're having to get the appropriate diagnosis and treatment. And so education is for those who might be experiencing issues, as well as those who may in the future or know someone to have a better understanding. So education, in my opinion, is empowerment to help people who are suffering get access, and those who aren't know that if it does happen, it's going to be okay.
Absolutely. I think that's a great point, because even in my practice, when we talk about just chronic pain or chronic issue, I get that all the time of, I don't know how to describe it to you. I don't know, I've had this and I'm not crazy. This is really happening to me, but I don't know how to tell you that. And so that gets a little panic for people, and they're like, well, maybe I am crazy. Maybe this is all in my head. Maybe this is this or not that or whatever. And then there's some self-doubt and some self-judgment placed.
Absolutely.
Instead of, let's have a conversation about it and know how to start having that conversation so that we can find the right people to help you.
Absolutely. And to let people know that neuromusculoskeletal dysfunction is so easily treatable when we can get on the same page about what's going on and what the approach is. And so many people come into me still afraid that they have cancer, even though they've been screened, because no one has told them this is a muscle issue. And I think the same happens in a lot of different areas of our body, is that we tend to think the worst when we haven't been fully informed about what's going on. And when we don't understand something, we're even more afraid of it. So this helps calm people down that a lot of times when they have issues with their pelvic floor, it's a muscle issue, and simply that we can work on. And once they get on that page that, oh, okay, I don't have cancer, or there isn't something severely wrong with me, then they start to become more comfortable with talking about it and participating in the treatment, and even discussing it with family and friends and other people in their lives.
Yes, that's exactly it. Getting that comfort level so that we can kind of move forward. So Nicole, let's move forward, and let's kind of refresh about the pelvic floor and what we're talking about. so that
Okay.
everybody has a starting point. So then we can start building on that knowledge of what's going on.
Okay. The pelvic floor is a sling of muscles and fascia that connect from the pubic bone right at the bottom to the tailbone, which is all the way at the bottom of the spine. And it literally creates a sling, and it supports the organs, primarily the bladder, the uterus, and the rectum, or the bladder, the prostate, and the rectum. It also is very much involved in urinary function, bowel function, sexual function, as well as pregnancy and delivery.
There's a lot that goes on in a small little space.
Yes. And all of those things are very private,
Mm-hmm.
and not things that we like to talk about, and therefore don't really know what's normal, what's common, what to expect. We hear a lot of old wives' tales that are still persistent today because of the taboo of all of those things. And so we go through life a lot of the time thinking that this is normal, or this is really abnormal and there's something wrong with me, instead of being aware that up to 75%, sometimes even more in certain studies, of people will develop or have or experience some issue with one of those at some point in their life. And so a lot of people think that there's something very wrong with them, when in fact they're more of the majority than the minority. And so there's this taboo, there's this fear around all of those things. They're all very private. And there's a lot of emotion involved with a lot of those things as well. So we've got all these layers of things that really prevent us from being able to have a frank conversation about what's going on down there.
Yes. So let's start with what's normal. Let's give everybody a baseline of what's normal,
Okay.
and then start dispelling some myths about what's not normal and what especially can be assumed as normal aging or normal issues down there. But you and I, as practicing therapists, know there's not, and we're always like, no, that is not normal. You do not have to go through life like this.
Right.
So let's kind of give a baseline for everybody, and kind of then dispel some common myths.
Okay. First and foremost, things like a pelvic examination or any type of penetration or intercourse really shouldn't be painful. That's not something that people should anticipate and expect and experience without knowing that there is definitely something that can be done about it. The same goes for urination and bowel function. Those bodily functions really shouldn't be painful and uncontrollable. So whether you have to go to the bathroom a lot, like urinate every hour, or have bowel movements very frequently, as well as the opposite. If you go all day, all night, or several days without having, a urinary void or a bowel movement, that's also something. So both ends of the spectrum. Normal, I hate using the word normal because none of us are really normal when we get down to brass tacks, but typical healthy urination is about every 2 to 4 hours. So we're looking at 7 to 9 times in a 24-hour period. And before the age of around 65, 0 to 1 times waking up at night to go potty, to urinate, is normal. After that, it's about 2 times can be normal after age 65, normal or typical.
And I think that's a good caveat too on the normal, because we're giving kind of a guideline and a baseline for what's going on, but then within that guideline, it's going to matter on your individual body and how all of your systems work together. But if you kind of have a loose guideline of what is acceptable and, for lack of a better word, normal, then you can plus or minus that within a certain deviation to what is normal for your system.
Yes, absolutely. And you also want to think about typical or average experiences for you. So some people get really worried if they're outside of those quote unquote normals for one time or one experience. And I always say, you know, if you twist your ankle one time, you don't really worry about it. You're like, oh, that was weird, and you didn't injure yourself. Sometimes the body doesn't work ideally all the time. So things like dehydration or over fluid intake, you know, or drinking things that cause you to urinate more frequently, or fatigue or stress, what you've been eating, those can all play a role to modify your typical or your average experience. And one or two times out of that quote unquote norm isn't something to raise a red flag over either necessarily. Like, our bodies just kind of sometimes don't always work the way we want, and that's okay too. I was going to say something else, but I forgot. So I'll let you take that back.
I interrupted you with the whole normal sidebar.
No, that was good. And then typically your urine, it's best if it's pale yellow to clear. Bowel movements should, a typical or normal range is 3 bowel movements a day to 3 bowel movements a week. Anything outside of that, and that's according to, it's called the Rome 3 criteria, and a bunch of medical practitioners got together around the world and decided that that's healthy and normal. Now, what's normal for you might look a little bit differently, but typically it's best if your stool is about the size and shape of a banana, soft banana. You know, hard lumps or real soft stool all the time isn't necessarily healthy, because that can put undue strain onto those muscles down there. Also, you shouldn't really need to strain or push to have and we'll go over straining versus pushing. You shouldn't have to strain to have a bowel movement or to empty your bladder. And for some people, they need to move around and do some bladder Olympics to get their bladders to empty, and that's perfectly okay. As we age, everything moves down. We all notice this, you know, in our skin, under our eyes and our elbows and things like that. Gravity has this effect, and so has that downward pulling effect. And so sometimes the bladder can kink over time, and so you have to kind of move around to get your bladder to empty. And it's really good if you can prop your feet up if you don't have a lot of hip or back issues when you have a bowel movement, because that straightens out the angle more for your rectum to be able to empty. So I gave a lot in a very small thing, and I didn't mean to go into too many details all at once, so we can go backward if you think that'd be beneficial.
No, I think that was a good way to space all that out. I think what I learned from that little bit was, it surprised me, the healthy range for bowel movements. That's a really large range, you know. When you see nutritionists and different things come across, because that's always a hot topic on social media, because it's kind of a sexy thing to talk about, right?
Yeah.
And like, you should have this many bowel movements a day or whatever. That's a hell of a big range.
It really, really is. And you're going to meet a lot of medical practitioners who disagree on, you know, what's normal and healthy. And, you know, my opinion of what's healthy and normal can be different than what the established criteria according to medical professionals in the world. And again, it comes down to what feels best for your body. You know, your bowel and bladder function typically shouldn't be something that's always on your mind. You know, if you are in the bathroom a lot because of whatever, or if you spend a lot of time in the bathroom, that might be an indication that things aren't functioning optimally for your body. And it still could be outside of that typical or normal range. But what we're looking for is for your bowel and bladder function to not be on your mind, weighing you down, preventing you from participating in the activities that you want to participate in, whether it's social or intimate, personal. your job, things like that. I've worked with so many people over the years who were confined to their homes for big chunks of the day because of their perceived problems with their bowel or bladder function. And they stopped participating in church activities and family camping trips because it continued to worsen, and it was really on their minds in a heavy way. And what was great was to work with them to improve that so that they could participate in the activities that were important to them, and their bowel and their bladder function weren't weighing so heavily on them that they could do the things that brought them joy again in their life. So it really shouldn't be something that weighs on you and prevents you from doing the things that really bring you joy in life.
I think that's a great point. And I think that is kind of setting the expectation at the opposite end of the spectrum. We've talked about what's kind of normal in that range, and then setting that top end of what is not normal and not expected. So let's talk about some of these wives' tales or myths of it's okay if I leak a little bit when I laugh or I sneeze. And we're, per this recording, we're in the fall of 2019. And I know my allergies were bothering me yesterday, and I have a lot of people in my life who are on the allergy kick right now with a lot of sneezing. So let's kind of dispel some of those common myths, because as you and I both try to educate people of this is not normal, and then who do I need to see who can help me with that, versus just getting the mainstream media or the mainstream advertising of different products that can help, that I can just use because this is my lot in life now.
Mm-hmm. Well, if you think that you're the only one who's experiencing a little leakage or some bowel issues, go to the pharmacy, go to Target, go to Walmart, look at the aisles of incontinence pads and diapers and bowel dysfunction things, constipation aids, and aisles and aisles and aisles of it. So it's happening to a lot of people. A big wives' tale is if a woman starts to leak urine with cough, sneeze, laugh, or a strong urge, or bending and lifting and carrying or jumping after she's had a baby. I had a lot of women who brought that to their obstetrician, gynecologist, or primary care physician after they had a baby, and they said, I started leaking afterward. And they were told, well, you had a baby, that's just what you need to expect. That's not necessarily the optimal function of your pelvic floor after you've had a baby. Some women experience those things if they've never had a baby, and having a baby isn't the number one predictor of leakage. It's whether or not your mother had leakage or prolapse issues. So we inherit some of the ability of our muscles to recover from things like that, where those muscles were lengthened and stretched from our mothers. And so there is some genetic inheritance that goes along with that. But if you've had a baby or haven't had a baby and you leak frequently, like I said, 1 or 2 times in your life isn't necessarily something to raise a red flag. But if it's something that's happening regularly, several times a week or several times a day, that's not necessarily the typical thing that your pelvic floor experiences after you've had a baby. And it doesn't mean that you're stuck with it either. So the common thing is to put a pad on it, like literally just get a pad, Brooke work, and poise that, change the conversation of, they now call it light bladder leakage. If you're a woman, of course you leak. Well, that's not necessarily the case. And it's, you can definitely do some things to improve the function of those muscles that control the function of your bladder being able to hold urine. So your pelvic floor muscles pinch that bladder urethra area, and if they are not strong enough, a little bit gets through. And pelvic floor muscle training has 11 of the highest level evidence to indicate that they can improve leakage with cough, sneeze, laugh, lift, bend, carry. It's called stress urinary incontinence. So there is more high-level evidence supporting that pelvic floor muscle training can improve that stress urinary incontinence than doing nothing or having surgery. So women are often geared towards, they just put a pad on it and they wear pads, or they're geared towards surgery. And up to 50%, and this is in the literature, up to 50% of bladder suspension surgeries fail within 5 years.
That's a big number.
It is. And, you know, the easiest way for me to understand this and to communicate it is to think about, almost all of us know someone who's had a surgery for their rotator cuff, or their rotary cuff as we often hear it.
Mm-hmm.
And think about if you know someone who's had shoulder surgery and whether or not they had physical therapy afterward. I don't know anyone who's had shoulder surgery and didn't have physical therapy afterward. And the reason is to retrain the muscles to support the shoulder so that that surgery doesn't fail. Even if surgery is the best option for you, and I highly encourage that you go through some pelvic floor muscle training with an appropriately trained medical practitioner. So even if surgery is the right road for you, almost no one is recommended to have physical therapy afterward. So those muscles to help support that surgical implant, so to speak, are not retrained. So it's bound to fail because we're not supporting it with our muscles and our other, you know, structural function usage parts afterward. And that just kind of, when I think about it that way, I'm like, oh wait, that's kind of weird.
Mm-hmm. Mm-hmm.
And that might be something that's more easily digestible to our listeners.
Sure. So if I'm sitting here listening to us jibber jabber about the pelvic floor, and you keep telling me that we can do pelvic floor retraining, so essentially you're saying I can work out my pelvic floor muscles just like I could work out my shoulder. In that case, how would I go about having that conversation with my doctor or medical professional, and where would I look to go to? Because Dr. Google is not always the best place to get. You can get conflicting information from the Dr. Google.
Yes, absolutely. And often we find the worst case scenario because that's how our brains are trained to survive, is to focus on the worst case scenario. So when we look something up, we're going to pick out the worst information that we can find. So what's important is to identify, you know, get clear on what your symptoms are. Do you leak urine? Yes or no? When does it happen? When I laugh, sneeze, cough, bend, lift, carry, move a certain way? How often does it happen? How much am I leaking? Is it when I have a full bladder? Do I leak with a strong urge? When you leak, if it's because of that cough, sneeze, laugh, bend, carry, lift, jump, versus if you have a strong urge, those are two different, slightly different causes that are treated slightly different. Both can benefit from working with an appropriately trained pelvic floor practitioner. So it's important to get very clear on your symptoms. You know, do you have pain with arousal? Or do you have pain with any type of insertion of a tampon, a finger, a speculum, a penis, a toy? Do you have pain with penetration? Do you have the inability to have an orgasm? Or do you have pain with orgasm or afterwards? Do you have strong urgency with your bowel movements where you've got to, you know, you would push through a crowd of an army to get to a bathroom with urge for urinary function or bowel function? You have to push really hard. And a strain, I'll go through that. You have to strain when you have a bowel movement or even to empty your bladder. And I consider a strain that the easiest way to describe that is if you have to hold your breath and push hard. And the way you know that is if you make a sound afterwards. You go, and then release your air all at once because you've been pushing. Straining to have a bowel movement or to empty your bladder puts a lot of undue stress on that. And do you notice that happening at other times too? If you're bending, lifting, carrying something, different activities, do you have to wipe a lot after you have a bowel movement? Like a lot. So those are the more common symptoms that you can describe using words like excessive, or I leak when this happens, or I have pain with this. And if your doctor is dismissive, your physician is dismissive, it's time to talk to someone else. Or if they recommend a pill or surgery or nothing at all with those symptoms, it's time to talk to someone else. Unfortunately, pelvic floor muscle training is a very good option for all of those symptoms, but isn't widely known. And that's part of the fault of physical therapists in our organization. We haven't done a very good job at describing what we do and how it's beneficial. So, you can start talking to other practitioners, other physicians to find out, how do I get to the right person? And I can tell you that not a lot of physicians have the appropriate training to assess whether or not you have a muscle issue, because a lot of those symptoms I just described can be either all or primarily associated with muscle dysfunction. And not a lot of physicians have the training to assess if it's a muscle issue or not. They're excellent at identifying their specialty issues. Physical therapists, we're musculoskeletal experts. So we're really the best ones to help make that muscle diagnosis. So if you can talk to someone who can get you to talk to a pelvic floor physical therapist, they're going to help you make that diagnosis of it, whether or not it's a muscle issue and to what degree that plays in your symptoms.
Whew.
Yes, it's
Girl,
a lot, right?
Girl, I think of so many knowledge bombs dropped in a short amount of time.
I know. I get on my little box and I just go, and I'm like, oh yeah, I'm not talking to myself, right?
Right. You're so awesome at that. So awesome at that. So I think with that, we'll wrap up today, and if people have questions, where can they contact you? And I think we're going to have to do a third conversation. I think we're awesome. I think today was a good building block on what is considered the normal realm of pelvic floor function into going through what is slightly not normal all the way to hitting that spectrum of what is really not normal for somebody. And then I think we need to come back and have a conversation about specific things. We talked a lot about stress incontinence today, but, we'll come back and talk about other pain dysfunctions in the pelvic floor and different things going on, and kind of go through dispelling the myths of age ranges and activity. Oh. We touched on that today, but kind of we'll dispel that in our next conversation about what's going on. Because I think, I just love these conversations with you, that we can continue to move this conversation forward and have forward motion and moving that needle forward to help people, because you're exactly right. PTs, we know what we do. You and I are both physical therapists, and so we get it, but we don't need to be talking to ourselves. We need to be talking to we need to be talking to the public and people who actually need help.
Yeah, it totally boosts our ego to talk to each other, but it doesn't serve anyone further than our own egos. So this is really important to break these down, help remove the barriers, educate and empower people so that those who are experiencing these or even suffering from them can get the information and get the courage to bring it up to someone to find some resolution. You know, that's why I really got into this topic, is because it is so private and it is so important for so many people to be able to do the things that matter to them. And this causes a lot of icky feelings for people, and it doesn't really need to.
Absolutely. So if somebody's listening here and they're like, gosh, I really connected with Nicole and I want to reach out, where can they reach out to you, and where can they kind of steer their Dr. Google searches if they're not ready to talk to somebody in person but would like to get the correct information, kind of steer our listeners to the correct Dr. Google searches, and if they want to reach out to you for more information?
Okay. So on social media, on Instagram, I'm Pelvic Floor Expert, Facebook, also Pelvic Floor Expert. They can email me, Nicole at drnicolecoleman.com, if they have questions. I also have a YouTube channel that talks about a lot of these things, so they can learn a little bit more about some of these issues and how to self-diagnose and little tidbits of treatment. Also Pelvic Floor Expert on YouTube. There's a lot of good resources out there. Specifically, I know that on Instagram, My Pelvic Floor Muscles, they provide a lot of educational videos and information about how to find someone if you're ready to have the conversation. Tracy Scher and Pelvic Guru has a lot of information through her blog that you can read about pelvic floor issues and how to talk about it. So those are some of the primary ones. The American Physical Therapy Association section on women's health. They have a lot of consumer information. So those are some really good key ones.
Awesome. Well, and I think that'll be a good starting point for people if they're not ready to take the next step and have the conversation.
Oh yeah, absolutely. It usually takes several months, if not years, for people to be ready to have a conversation and move forward with whatever diagnosis or treatment that might be best for them. And that's understandable because it is so private and difficult to talk about, and it has so many emotions involved. And we often need to really find out what we're experiencing. Sometimes we just kind of like, if we're having issues, we don't even think about it. So sometimes we need some time to think about what's really going on, and then some encouragement that this isn't probably what you think it is, which is thinking that it's worse than it is. It usually is not as bad as you think that it is.
Oh, so much good knowledge, so much good information. So
yeah,
thank you for
fun.
Thank you for coming on today, Nicole.
Thank you for having me. I feel so blessed to be invited as a guest because I just love the conversation that you're having to people about their bodies, and also, of course, about riding, which I know nothing about, but I find myself deeply intrigued by. So I appreciate that I'm learning things that I would have never learned about too.
Aw, thank you so much. So we will set up another time and have a third conversation that will probably lead into a fourth conversation down the road. So
I love it.
Till next time, everybody. This is Rider's Edge Podcast, and I will see you down the road. Thank you for listening to the Rider's Edge Podcast today. We appreciate your time and attention. Thank you for always helping us move the conversation forward. If you liked today's podcast, please help us keep the conversations going by subscribing to this podcast, and consider leaving us a review so others can find us and join in on the conversations. You can also find more information by checking us out on our social media channels, including Facebook at Rider's Edge Therapy and Wellness, Instagram at Rider's Edge Therapy, and our website, www.ridersedgetherapy.com. It is there that you can book a consult for either you or your horse. Thank you, and as always, we will see you down the road.